Teeth function for a purpose other than chewing. They actually maintain the strength and the structure of the jaw.
Losing teeth, have no teeth in the mouth is a lot of psychological issues for the patient.
Patients that lose teeth need implants. Patients that have been wearing dentures for long term need implants.
Some patients have terminally ill dentition. That means we cannot save their teeth anymore. Severe periodontal disease that they have, or gum disease. So what we do is we recommend extracting their teeth and place the implant the same day. And we also put the teeth the same day, which is great.
They look at it and they're just amazed of being able to smile again without teeth that move, but something that is really rigidly fixated in place.
They can chew with those, they can smile, we can make those look really, really nice for the patients, so they go from ugly loose teeth to the beautiful smile.
Dental implant really is simply a titanium screw.
It's the same exact metal that we use for like hip replacement or any other part of the body that we need to connect to the bone, and is biocompatible. Or you broke your arm and they put an implant, they are all the same exact material. They have been out there in medicine for more than 80 years, and in dentistry they have been there for about 30. So it's a pretty safe treatment option. It's very easy procedure, practically painless with the way we do it here at the Great Small Dental, because we don't cut the gums open. We don't need to really place sutures. It's a new approach in dentistry. We call it tissue level implant placement, not bone level. Most of my patients, they take pain medication the day off, and the morning after, they don't need to take anything.
When wearing dentures, what happens is the pressure from the denture applies forces to the underlying bone, which cause the bone to shrink.
Once the bone starts resorbing, it makes the face sink in at the same time. That's what I don't know if you ever notice people with dentures. Once they remove the dentures, the entire face collapses because the bone has been gone. By placing of the implant, your facial complexion, everything looks the same. Nothing will change. I would never want my face to collapse. So if I'm missing a tooth, I'm gonna make sure I place an implant because I don't want to look old.
When you have an implant, the similarity between that and the tooth is that it stimulates the jawbone. So anytime you chew, there is a certain amount of bone surrounding the implant which takes the vibration absorbed from chewing and causes the bone to continually, as we say, remodel around the implant to basically stimulate regrowth year after year after year.
So when we have dentures, we usually have problems, especially with the lower arch, because there is no palate down here. It's the tongue that keeps hitting the denture. So lower dentures are never good. They always move, they always rock.
Food gets trapped underneath them when you're chewing with them. When we can transition them into implant-supported bridges, same thing, it's like returning their natural teeth back to their mouth.
That's why we recommend implant over denture. So we place implants and the denture is hooked into the implant. That way it does not move as much and they can chew their food properly. Implants last a long time. For each implant, we have 98% success rate for 10 years. We have about 90% for 15 years. So it's really, really good. It's the best long-term prognosis treatment in dentistry. Once the patient comes to a Great Small Dental and they do need any type of implant procedure, first thing we do, we take a CT scan. That we have it here. With the CT scan, we can see three-dimensionally everything. Height of the bone, width of the bone, sinuses, nerves, where everything is. And then we review it with the patient.
We have people that have had periodontal disease or gum disease that literally have come in where their teeth are moving. And we've extracted their teeth, placed implants, and they walked out that day with teeth fixed in place. It's life-changing. Really has done just wonders for people. Not only functionally, aesthetically, and also just from a personal standpoint of confidence.
So it is definitely possible to walk out of the office with brand new set of teeth with all-on-X type procedure.
There's two different types of All-On X: Snap-On, which is a removable prosthetic appliance, and really it's a conventional denture which has been converted to a Snap-On, the fixed version, which is screw retained. So same concept, a multitude of implants. There may be two. There's normally 4 to 6 to 8. Traditionally in America it's called All-On 4, All-On 6, or All-On 8. Non-removable. So very much like your teeth, you must be very, very diligent about brushing and flossing, use a water pick around it. Otherwise, food accumulation that does occur around this type of bridge can lead to gum issues, just like teeth.
What it differs from traditional is like if the bone is thin here, we can place the implant with an angle, okay? So where we have more bone, usually in the front, we place the implant straight like traditional, and then in the back, we place them with an angle. So that gives us more connectivity from these 4 implants together, and we are able to restore it with much cheaper material.
You know, if somebody doesn't disturb it during its first 8 weeks of healing, they're going to heal great. It's a protocol of sticking to a liquid diet, then progressing to a soft diet, and then eventually after about 3 months, then you can start to pretty much eat anything you want except for nuts. You know, the final restorations can handle any pressure. The majority of our patients will be fitted with a protective night guard that'll act as a shock absorber at nighttime. So we take all measures in this office to make sure that we equip the patient, you know, for everything they need for longevity. Americans, they want everything done yesterday. We found that that's not the best way. So there are quick ways of doing things, and then there are more conservative ways. I always tell people, if you let me do it as if it was my mouth, I can guarantee you in 10 years your implants are going to be there 99% of the time. Placing implants can take several months to sometimes, depending upon what case a person presents to us, it could take 2.5 years.
Because it's case by case, everybody's different, everybody's need is different, everybody's bite is different.
But I have always heard from patients, it's well worth the wait. But when you're done and they get to chew again with that implant-supported crown, it kind of just is life-changing.
We are pretty much experienced practitioners here, me and my colleagues. We have placed implants over the years. Like I have been placing it more than 17 years. My other colleagues have done it almost 30 years before me. And also because of being general dentists and work with patients, we know how to restore them.
I'm currently a diplomate status at the International Congress for Implantology, board certified implantologist, and it's taken years to get there. So the level of competence that I'm at right now, being able to assess the needs of any individual, letting them know are they really a candidate, and letting them know what their odds are, and if there's going to be any seen or any foreseen complications, I can pretty much tell them spot on. In our office, we always focus on what's right for the patient, so we're going to take the time to explain everything in detail. We want to make sure that we have our patients have as much knowledge so they can make the proper decision for them.
We never do anything till the patient fully understands what is going on and what is the best treatment option for them. You guys can look us up on our website, Facebook, or online Google reviews, and then you can feel a little bit more comfortable. But we always offer free implant consultation for all of our patients or new patients they come in.